Jó napot kívánok mindenkinek, Henrietta vagyok, és nagyon szépen köszönöm, hogy itt lehetek ma önökkel. Good afternoon, everybody. My name is Henrietta, and it is an honor to greet you on my mother tongue Hungarian. First, I would like to acknowledge the traditional custodians of the land on which our services are operating, the Noongar Nation, and specifically the Whadjuk people. We also acknowledge the elders of the LGBTI community, elders past, present, and emerging, and we express our gratitude for the recognition and acceptance the LGBTI community experiences today. And we also acknowledge the elders of the multicultural, multilingual, and multi-faith communities who serve as an inspiration to Umbrella Inc.'s mission, vision, and values. And as we stand on their shoulders today, we celebrate and continue to promote respect and inclusion for all. A little bit about Umbrella. We are 22 years old and we have been operating in a Perth metro area. 22 years ago, a group of people from culturally and linguistically diverse background came together and said that some of the services that were provided at the time were not suitable for their community members, so they wanted to create their own, and that's when Umbrella became what it is today. Today we provide mostly HK services, so services in the community under the home care package and community Commonwealth Home Support Program, as well as we have CVS, Community Visitor Scheme. We're part of the Carers Gateway project, and as well as the Village Hub and the Encompass Multicultural Connector. So quite diverse portfolio, mostly focusing on elderly, cultural and linguistically diverse communities. We have around 1,000 clients from 67 different countries, and we speak 57 different languages, so quite diverse. And we like to share what we know because, and also I truly believe in that we only can do so much if we share and we collaborate. So because we want to improve the system for all. A little bit about me. I have 11 years of experience, including with Carers WA, so very excited to be here today. And I'm the Senior Manager for Communication and Engagement, so a lot of my projects are relevant to carers. And I do have an accent, and that is Hungarian. Just a little bit of statistics about just general diversity and the carers. So what you see is from last census, so 2021, 51.5% of people are either first or second generation. And then we represent over 221 countries and over 249 languages. The 130 religious faith is always amazes me, the data, but it is true. But unfortunately, this is not the recent one because they couldn't give me how many faiths we have. So it's 130 as we know from 2016. When it comes to carers, and you see this is from Carers Australia, that's the only thing I could find on carers, and I trust Carers Australia because I know that they have their figures. As you see, it's an estimate, so 25 to 30%. And why is it an estimate? Well, a lot of the actual data and information around cultural and linguistically diverse communities are an estimate. It's not an actual fact. So when we're working with them, most of the time they're not. We're actually working with figures or underestimation of that. So we are working in the HK sector, so I wanted to show you this one, why it is important. A lot of the time, it's about the communication. As you see in the HK sector, currently the Europeans are more heavy, so more European languages are needed, while as you go into the younger carers, that's going to shift to more the new and emerging languages and languages from other part of the world. But currently what we're working with is mostly European, especially at Umbrella. Obviously, we were established by the Eastern European communities, but it's generally just reflecting on what's happening in the HK sector. And this is important because when we want to communicate with carers, we need to know where are they, and we need to do the age, because that's going to be determine what languages we're going to use. And then there's some really great demographics about the current state of our aging in Western Australia. I highly recommend this report, not just because we are in it twice, but because it's a really good tool if you're working with the older generation and those communities. Now, communication. Let's talk about the wonderful word for care. What does it mean? Well, when I was with Carers WA and worked there, and I clearly remember that was but we're already in the middle of advocating to change the meaning behind the word carer. For a long, long time, carer also meant somebody who getting paid for what they do. And back at the time, I clearly remember like, no, it's carer is only for unpaid carers, for those ones who are looking after their loved ones, their friends, their family members, and not for those who are getting paid to do that job. And happy to say that after 10 years nearly, it is means in English it means the carer, the family or the friend who is looking after an unpaid care, and we call the carer those people who provide care for paid positions support workers in most scenarios. And this is really, really great. But when I meet with carers from cultural and linguistically diverse background, they often says, Henny, this word doesn't exist in my language. And it's always found it fascinating because even in my language and many other languages, when we actually dig down, we actually can find a literal or the mirror translation of this language. So why is that they say, no, it is actually no word in my language? Where often than not, that transition in meaning of the word carer in English in Australia, the one that went from paid carer to carer of families, didn't happen in other languages and in other cultures. So what we are working here is, it's not just that we're not able to translate the meaning, is that when we translate the meaning, they still mean that old way of thinking about the carer. In Hungarian, it's gondozó, and yes, if I say that to my parents or to my family in Hungarian, they're going to think of somebody who's going to get paid. So this is why the carers, more often than not, they reject. So it's not that they can't translate. In fact, in Hindi, there's over 32 different ways to say I care. How beautiful is that? There is word for it. But the meaning in those languages and cultures, unfortunately, didn't shift it from the paid position to actually meaning only carers, which is obviously empowering, because when you're advocating and when we're advocating for carers, it is really important that we can name of what we are talking about. And this is really great that it happened in English and it happened in Australia. But unfortunately, that's not necessarily true for many culturally and linguistically diverse carers. And I'll give you a couple of examples of where translation and communication can go wrong. One of them, the first icon is actually the 8 standards for aged care, which is really, really great. It's made it simplified. It tried to unify the industry. But how those standards are starting is, I have a right. I have a right. I have a right, which is fantastic and makes sense in English and makes sense in a Western world where there's very individualistic way of looking at things. But how I'm going to explain this to the Italian nonna or the Greek yaya or the Chinese nene, that all of a sudden you have a right and the rest of your family is not. Very difficult to translate, because these people exist in a system that everybody has a right and responsibility based on their age and their status in the family, where most family members, when they get to that age, happily handing over all their human rights under the UN Convention to their sons, because that's what they have done for thousands and thousands of years. And this is where a lot of the communication goes wrong. And this is why it's really good. And a lot of the work that I am doing is actually that engagement with the communities before we put something to them, so we understand what is their understanding behind this particular term or particular system, so we can actually modify it in a way that they can understand. Because it's not that, grandma don't need, or babcha or nonna doesn't, shouldn't have rights. It's just we are not communicating with the system that they understand. The other thing is, beautiful word again with Hindi, is the wording translation of dementia. So often than not, I'm recently working with Dementia Australia a lot. And what we found with a lot of the communities is that they either don't have a word for directly, not using anything similar to dementia, because dementia is actually a very medical term, or they have the medical term similar to dementia, but that's not what they're using most often than not. They're actually using a term that is aligned with mentally ill or old aged. So it was really good to dig down and see how the community actually naming this disease, how the community actually talking about this, because we were then able to have that conversation on their own terms. And that was so, so powerful. So being prepared to talk to the communities even before you present to them what what you need to present, it's a really good way of getting them to understand what you are doing, and carers especially. So just a little bit of a few acronyms. Use them, but use them wisely. Most communities don't understand any of this Just FYI. So use it for your reports, use it for your communication, getting grants. But these words, as much as they're useful, more often than not, nobody understands them. Nobody understands them in the community. My favorite one is multicultural, which is most of the time is like, it should be a quiet, okay term to use. But clearly remember in this expo, I was there with Umbrella Multicultural and had this Italian couple coming past, and they looked up and said, nah, this is not for us. And we were like, well, we have Italian groups. Our biggest group is Italian. What do you mean? And they looked up, well, we are not multicultural. We are Italians. So again, when you work with communities, use the way that they like to be described. You can use language. So we have the Spanish-speaking groups are quite big but diverse. They're coming from lots of countries, especially Latin American. The Arabic-speaking community, again, comes from they come from a lot of countries, as well as a few religious faiths. It's not just, it can be Christianity, but also it can be Islam. So it is Islam most of the time, but also can be Christianity. So it's really important to use the right wording. Now, carer stories, and these are the stories that I had, and the people I work with, and the project that I work in had, and it was very eye-opening. So I would like to share it because I learned myself, I learned a lot from them. So there's a few stories. One of them is the multi-generational care settings. It is difficult enough without having that cultural and language lens on it. A lot of the communities came, the ones that we are working with in the 60s and 70s, or they're actually refugees of the Second World War. So they're going back quite far. So by the time, if you look at today, second or third generation already exist, or sometimes even fourth. So it's quite, they can be quite a while. But the problem is, the further we're going down the generation, the least likely they are connected. So we're having that issues of communication and language. And then we have dementia. Some people actually came very young, and because the family didn't want to do with anything where they came from, they changed their name, Englishized their name, and the children never learned the language, or they lost the language because they said only English at home. We stopped using Hungarian, we stopped using Italian. We're not going to do that. And then old age comes. Some people, either because of dementia, revert back to their first language, and then the family is shocked to find out that they're actually not from England, or somebody had a procedure done, and because of the anesthesia, they came out not speaking the language anymore. And the family was shocked because she was an English teacher and they really thought they are from England. Having that issue. One other thing that we found is with these multi-generational settings, especially when we're talking about communicating difficult topics like cancer, is that the families love to be the interpreter, even if it's not a good thing to do. Because first of all, imagine that you're sitting there with your parent who doesn't speak any language, and then you learn that your father is going to die, or a very high chance. You need to observe that information. You need to do it. So yes, using an interpreter is very important, but sometimes the families insist on they need to do it. And they also want to filter of what they, translating to the person. So it can be very complex matter of interaction, and knowing when to use interpreters and translators is a very, very important part of working with cultural and linguistically diverse families, because that's very important. Yes, and the other thing is very important, and I don't think talked much about, and I had a little bit of an experience with the dementia project to work with those carers, the ones that have family overseas, and they, just because they are here doesn't mean their caring role stops. Often than not, they're actually more involved because they feel guilty, because they feel like they are the one that's responsible for the situation. So what they do is they often involved, obviously, the Zoom calls, the phone calls, paying carers. I met with a couple of community members who one community was from Bangladesh, and then the lady was talking about how she's trying to convince her mom that what her dad has is actually dementia. So what she learned here was very helpful. So I always refer these carers to Carers WA as well, if nothing else for the website, because I said, look, you're a carer, and and you can have information on this disease, you can learn it, and then trying to pass it on to the family back at home. But again, they have different situation. They may not have the same support network. They may not have, maybe they start their own carers, carers Bangladesh. You never know what going to spark. But we need to support them here because they are truly carers. They are there, sometimes have to fly. They spend a lot of time. So that was a very interesting story. And I can relate to that because my father has Parkinson's. So I actually had to learn what Parkinson's is here. And then I had to learn what's available in Hungary. And then I had to translate that to my sister. So yes, that was a very interesting scenario. But this is the it's not multi-generational, but it's all over, it's international caring. And that is happening in the community more often than not, especially because of the pandemic that really separated families for a long, long time. Carers who care for people who are who are on temporary visas. And this is a very interesting other subgroup that's happening with a lot of the communities, is that families are separated not just by distance, but they're separated by systems. So when you have a family member who came here as a father or a mother to look after the grandchildren, and then they have a stroke. And then what? Yes, they have, they have the medical insurance, but the person sometimes so unwell that they either have to return or they have to have more services in place that what the family can pay for. So that was very difficult scenario. The carer actually permanent resident, have a citizenship, but the mother was not. So no services was available. That was actually quite heartbreaking. And I think they ended up taking back the person home in the end. But what I found is the person was able to be supported. So the only thing that I could do was call Carers the BA and ask for help. And that was wonderful because you don't need to have a visa restriction. It's not it's about being a carer. And obviously the person was a person who was a permanent resident, but that was the only support service that we could organize. And then newly arrived carers, also the ones that coming in brand new, fresh and crispy, sometimes on a caring visa. So you can actually get a caring visa. It costs $3,500, but you can have a caring visa if the person can prove that you are the only person that can look after them. Then they can get a carer's visa in here. So obviously settlement priorities will be a different one. Learning the language, getting a job, so they also need help with that. Understanding the new systems and language. One of the complaints were when I was doing the cancer consultation with cold communities is that they didn't understand the health system because it was so different to what they used to in their countries. Like, for example, one lady had a cervical cancer and her pap smear. Usually the pap smear is done by a gynecologist in the country where she's from, including mine, right? And then she come here and the GP goes, yeah, off the table, on the table. I was like, what? Excuse me, you are just a GP. You're not meant to do this. So she had to be explained that in here is actually the GP does it and it's every 5 years. So they may need to be supported in regards to that too. Adjusting to less support, that's really critical. As a migrant, we severed from some of those support that's naturally occurring around people, and assessing that and knowing what's the limit of the support is really important. And sometimes the informal support is really important in the community. So not relying families as much, but people or members of that community. Navigating complex healthcare systems, carers visa I just mentioned, and the individualistic healthcare versus the carer. So translating and communicating health information can be difficult, as I mentioned before, because sometimes we're navigating between the I have a right to what we can, we have a right. So that even translating in between that. Then support services for carers. So there's a few things, especially the carers, the VA is obviously number one for us. And they have translated materials and especially, I hope this one will grow. Dementia Australia has 37 languages. So, if you want to catch up, that would be good. I know it is expensive, but it's well worth it when you utilize it right in the community. And we definitely benefited from taking these translations to the communities that we work with, and they really appreciate when they see their language. If you're bilingual, you're seeing your language on any flyer, I'm taking it. That's Hungarian, it's mine now. So it's really great. So please keep translating things. It is important, but it needs to be used wisely as well. Carer Gateway program, we're very lucky that we partnered with Carers WA, so we are helping carers to be referred to Carers Gateway through Carers WA, very successful, and we're holding different events and going to different communities. We're hoping to do one in the Iranian community soon, who are obviously quite in distress at the moment because of what's happening in Iran. So I'm looking forward to working with them a little bit more and see how their carers can get any help if they need to. Evelyn Berry is the coordinator for now, so please, if you have any questions, she's more than willing to help and assist and refer carers. Encompass project is the other one, so this is HK system related, but we can help the carers, and a lot of the stories that I told you today actually coming from the Encompass program. More often than not, we're working with the families, and sometimes it's an emergency situation because they don't know how the system works, they don't know how to access HK services. By the time we get to the families, it's an emergency, so a lot of the times we have to negotiate in between. So Encompass project is very important, and it helps culturally and linguistically diverse seniors to access the HK system. We provide individual case management on language-based case management, so we can actually use interpreting and translating all the way from calling My HK to actually getting services done through a provider. And it's not just for Umbrella, it's to anybody else. So it is an independent service that provided by my team. And yeah, any questions?
Online questions.
Yep.
First one, how can we better support ageing called carers to begin planning for the future of adults they are caring for? And if it's okay, I'll give you a second.
Sorry, again, the question?
How can we better support ageing called carers to begin planning for the future of the adults they are caring for?
Yes, well, that's the thing. There's a lot of information available around that, but what I think is missing, and it's a lot of work that I do, and that's when my experience is coming from, is that we actually haven't went into the communities and see the real situation. So every community is assessing, they've lots of similarities. So what I find, for example, with dementia, is that a lot of the communities, yes, they think it's just old age. Yes, they think it's just old age silliness. Yes, they think it's just mental health. They have even very similar words on their own language in regards to that. But sometimes how they perceive or how they work around it is very different. Like one of the communities was like, let's come together, let's solve this. We're making sure that we are dementia friendly from tomorrow and remove this and use bigger signs. While the other community said, Henrietta, this was really great, but our families were not going to come forward because in our belief, if you have dementia in the family, your DNA is spoiled. Now, that was an interesting conversation with the families and those communities. So I know when I need to now advise people to work with this community, I will say they are very upfront. They want to find solutions, versus this community is much more, you need to go down to that individual, which is very interesting because they are collectivists, but the actual solution to them was individual approach. So what I encourage is know those communities that you work with, and what are the possible issues that going forward. Because yes, language could be one of them. Second and third generation may not pick up the language as much, so the older person may have issues communicating later on. But a lot of the things we actually don't know. And again, that's why I said it's a lot of estimate. It's a lot of guesswork. So I would love to work with that person. Please reach out. Let's have a chat of how we can make sure that we know how all aging, culturally, linguistically diverse seniors can be looked after better, because, it really depends, I think, sometimes on the communities that we work with as well. I hope that answered the question.
Thank you. And I've got another one, if there's time. Great. Completely separate question. Do you think the word carer not having direct translation is also because it is seen as a natural way of supporting attached to being a mum, dad, sister, aunt? etc.
Yes, in certain, again, I think what's very interesting, sorry, it's the dementia, I'm going to refer to the dementia project, but I learned there a lot as well. And it was very interesting because in some communities, you can dementia, all around those languages. So they were fine. So those languages you can actually translate, but in some other languages, you can't because they're not using that word anymore. So yes, again, it really depends. And when we feel, oh, how we know we have 221 languages, Henrietta, this is going to be overwhelming. Start with the people that you know. And funny enough, once you learn around that, once you learn those people that you already work with, that you already communicate with, that you already know, then you can actually go further from this. So small steps, but I would really have a chat with people around what they think in their language carer means. But at the same time, just tell them that story. Hey, 15 years ago, carers meant this, but now it means this. Is it true in your language? Can you relate to the carer word now? So again, having that little work with the community is very, very important because right now, unfortunately, a lot of guesswork is happening. Translating is really good, but I always use that with me. So I'm not just handing a flyer in Italian or other languages that are on the website, but I also sit down and say, does it make sense to you? And it's actually what happened in Umbrella when the COVID-19 hit. Yes, we had a lot of translations available about the vaccines, but what helped is our bilingual support staff sitting down with the older person and reading it and understanding it together. And they were picked up some issues as well of how they understand the vaccine. So working with the communities is really important. You don't have to know every community, but if you start with the ones, even yours, I learned so much about the Hungarians since I'm working in this role. It's a good beginning and it's a reflection and it can be actually replicated in other communities around them. So I hope that answered the question.